Since the coronavirus hit our headlines a couple of months ago, more than 3,000 people have died of coronavirus, not only in China but also in other countries. In order to combat the coronavirus, numerous Chinese medical workers arrived at Wuhan for those patients contracted the virus. As a medical worker, you have to know that one of the most important ways you can keep yourself safe in caring for patients with coronavirus is to make sure that you learn to put on and take off personal protective equipment in the most appropriate way. Now, a team of physicians from Zhejiang Provincial People's Hospital has provided us detailed guidance for trained modules in this video. We have been together and working long hours to show you the most appropriate ways to don and doff personal protective equipment. We should be confident that if you could put on and take off the personal protective equipment in correct ways after proper training, you can safely take care of these patients. So, we hope you enjoy the video and really appreciate for all you do for the patients. Rinse your hands with plenty of soap. Change into clean surgical scrubs and footwears in a suitable clean area. All footwears should be closed toes and closed heels with no hose. All personal protective equipment should be inspected before using and ensure they are in serviceable condition. We strongly recommend to using professional anti-fogging spray or liquid soap to avoid fogging of goggles. We recommend wearing 3M 1860 respirator mask when carrying the patients. In case it is unavailable due to the outbreak of the coronavirus, you could use N95 plus surgical face mask instead. All personal items, including watches, jewelry, etc., should be removed. Ensure your nails are no longer than 1 millimeter so that they do not punch the gloves. Perform proper hand hygiene following the standard 7 steps according to CDC, which includes the palms and backs of your hands, between your fingers, under your nails, your thumbs, fingertips, and your wrists. Make sure you should perform each step for 15 seconds at least. We will just recommend saying happy birthday to you from beginning to end for each step. Hold the respirator in the palm of your hand. Place the 3M 1860 respirator on your face, covering your nose, mouth, and chin with the respirator, and put the bottom strip up over the top of your head and put it behind your neck and below your ears. Put the upper strip and put it behind your head. Move the nose piece and ensure it fits your nose and face to obtain airtight seal. Also check and follow the instruction of your respirator and perform a check to make sure it is airtight against the skin. Put on your inner surgical cap. Make sure no hair and ear is visible. Put on your inner shoe covers and inner gloves. Try not to touch the floors with your hand while putting the shoe covers on. Choose the proper size of coverall. Put down the zip completely. Hold the cap and sleeves. Try not to touch the floors. Put the lower extremities in first, and then with upper extremities. Put on the cap and make sure it covers the inner surgical cap. Put up the zip completely and seal it carefully. Put on your booties and make sure they're secure around your ankle and calves. Wrap the strip around for a comfortable fit. Try not to touch the floors with your hand while putting the boot covers on. Put on medical layer gloves. And we strongly recommend using different colors of gloves so that any bleaches gloves could be rapidly identified. Put on surgical face mask, which is optional if you're wearing 3M 1860 respirator. However, it is necessary to do so if you're wearing N95 instead. Push the goggles on your face properly and make sure it covers your eyes. No skin and hair should be visible. Put on isolation apron. which could provide you additional protection, and put on outer shoe covers and gloves. No exposed skin or hair should be visible at the conclusion of the donning process. And you should make sure that you have full range of motion and can move your arms, legs well, and can bend your waist. Only if you need to perform some special procedure which is at high risk of contamination by the droplets from the patients, we will recommend you to put on surgical cap and face shield. In order to do this, put on surgical cap first, and then you have to bend forward slightly and put the foam of face shield on your forehead and place the elastic band behind your head. Before leaving the patient's room into the doffing area, inspect your personal protective equipment for any obvious sign of contamination or materials on it. If so, you need to disinfect the surface with the disinfect equipment first, and rinse your gloves with alcohol-based band rubber or running clean water. Perform hand hygiene, which should be performed between any single actions during doffing procedure, and should always follow the standard 7 steps protocol. As you remove each item, remember to place it immediately into the designated waste bin. Remove face shield if used. You need to bend forward slightly and try not to touch the outer layer of the face shield during removing it. Hand hygiene again and take off surgical cap if used. Hand hygiene again. Take off outer layer of shoe covers. Try not to touch the outer layer during removing it. Hand hygiene again. In order to remove your outer layer of gloves, we recommend you to use your right hand to pinch the out layer of the outer glove on your left hand. Lift it and roll it down to the metacarpophalangeal joint. Then using your left hand to pinch the outer glove on the right side and rolling down until it's completely off your hand. Finally, using your right thumb to pull down your left outer glove until it's completely off your hand from its inner side. Discard your gloves into the bin. Hand hygiene again. Remove the apron by untying the strips first. Then perform hand hygiene again. Put your right fingers into the left sleeves. Pull the sleeves down till it covers the left hand and fingers. Using your left fingers, which is covered by sleeves, to pinch the outer layer of right sleeves and put it down till it covers the right hand fingers. Take off the apron and fold it, rolling the apron from inside to outside and away from your body and discarding it in a proper bin. You should be very gentle to avoid spread of the virus and never touch the outer layer of the apron with your hands. Perform hand hygiene immediately. Hand hygiene first. In order to take off your goggles, you need to bend forward slightly and try not to touch the outer layer of the goggles during removing it. You need to keep your eyes closed during the removal procedure. Hand hygiene again. Take off your surgical face mask if used. Close your eyes during taking it off as well. Perform hand hygiene. Untying the boot covers and hand hygiene one more time. Bend forward slightly. Gently unseal the coverall and pull down the zip completely, rolling back the cap of coverall and put it down towards the posterolateral, rolling it down from the outside to inside till the middle of calf. Take off your sleeves and medical layer of gloves at the same time, and take off your boot covers one by one from the inner layer. Try not to touch the inner layer of coverall when you still have your medical layer of gloves on. And be gentle to avoid falling down. Be careful to avoid taking off the inner surgical cap at the same time. Perform hand hygiene again. Perform hand hygiene again and take off inner shoe covers. Hand hygiene again. Take off inner surgical cap. Hand hygiene again. Take off inner layer gloves following the way mentioned above. Hand hygiene again. Bend forward slightly, lifting the lower strip of the 3M 1860 respirator mask and pull it over the top of your head and hold it with one hand, and using the other hand to lift the upper strip and take the respirator mask and dispose it. You should hold your breath and close your eyes. You should be gentle to avoid spreading of the virus. Try not to touch anterior face of the respirator mask. Hand hygiene again. Put on new surgical face mask and cap to cover your hair and ears. Rinse your hands with running clean water with plenty of soap. We recommend you to take a shower and change into clean surgical scrubs and working shoes.